Thank you everyone for joining us today to speak with Dr. Meg Chisolm about the role of arts in medical education, especially with regards to professional identity formation. Before we start, I just wanted to introduce our guest. Dr. Meg Chisolm is Vice Chair for Education and is Professor of Psychiatry and Behavioral Sciences and Medicine at the Johns Hopkins University. She is board certified in both general psychiatry and addiction medicine and has 3 decades of clinical experience in these fields. She has served as PI or co-investigator on multiple nationally funded research projects and has published over 100 scientific, clinical, and medical educational papers on psychiatric disorders and humanistic medical practices, as well as articles on the use of social media in medicine and a psychiatric textbook. She has provided mentorship to all levels of trainees, including junior faculty in psychiatry, internal medicine, and other fields locally, nationally, and internationally. She's also a member of the Miller-Colson Academy of Clinical Excellence and the director of the Paul McHugh Program for Human Flourishing, where she uses the arts and humanities to explore the big questions: what it means to be human, to be a physician, and to lead a good life for doctors and patients with medical learners. Thank you so much for joining us today, Meg.
Thank you, John. Pleasure to be here.
So I thought we would just jump into the questions and start off with, if you could tell us about what led to your interest in the arts and humanities, as well as its relation to medicine.
Well, how far back do you want me to go?
Yeah, however far back you want to go.
So, I mean, I feel like I've come full circle in my life. So my major in college was visual arts with a concentration in film. I was particularly interested in film history and actually had been accepted to graduate school in cinema studies at NYU. And it was at that time that I got cold feet about furthering my education in the arts, and instead wanted to do something that I thought had more immediate sense of meaning and purpose. And so started the path to medical school. I had to go back and take all my pre-med requirements because I hadn't done much of anything in terms of the sciences before graduating from college. So I got interested in medicine because I was reading the works of John Berger, who's an art critic. And he wrote this book called A Fortunate Man with a photographer, Jean Moore. It's really a photo essay about a country doctor in the UK. And it was reading that book that really sparked my interest in medicine. I didn't know any physicians other than my own pediatrician. I had no physicians in the family or friends. And so I really didn't know much about medicine when I got into it, other than what I read in this wonderful book, still wonderful book, A Fortunate Man. And so that started my journey. Didn't really do much in medicine related to the visual arts. In medical school, I did do one independent elective where I was looking at paintings for signs of various, medical conditions like, I don't know, Bell's palsy or a dropped foot or something like that. So I did that. Then I did my residency, really didn't do anything in my psychiatry residency related to the arts. And it wasn't until a long time, fast forward in my career, in 2015, when I went to the Harvard Macy Institute's Health Professions Education course. And as part of that course, there was an elective opportunity where you could go to the Boston Museum of Fine Arts and engage with a museum educator in a visual thinking strategy session. So I did that and I was like, oh, a light bulb went off. There is a connection between the arts and medicine. And so that really started my interest, or revived my interest in the arts and ways to connect it to medicine. And so after that, I went back and we had a wonderful emeritus faculty member, Jim Harris. He's passed away this year, who has written all the essays. I think there were over 150 essays on the JAMA psychiatry, used to be the Archives of General Psychiatry covers. They would always feature a piece of art, and then he'd write an essay about it. And so using his expertise, we went down to the National Gallery of Art, where 4 pieces that he'd written about were. So I took groups of psychiatry residents down there, and we did, well, I didn't know what I was doing at the time, but I tried to lead visual thinking strategies sessions. And then, and we wrote a paper about that in academic psychiatry called a mentored writing experience. It was part of an elective I designed for the residents, the first year residents. Anyway, and then lots of other things have happened, and I've gotten really deeply entrenched in the field in the last 6 or 7 years.
What about the visit to the Museum of Fine Arts in Boston kind of sparked your interest? Was there a particular painting, or was it something that the person there was doing that sparked your interest in it?
Well, they use this method, this visual thinking strategies method. I still remember the painting. It's Two Lovers by Kakashka. And it depicts, yes, Kakasha with Mahler's mistress, I think, or his mistress that was Mahler's wife. Anyway, it was more the method. So I got very interested in the method of visual thinking strategies, and actually have gone on to take courses in that from Visual Thinking Strategies, the corporate company, and have become certified as a facilitator, and have now I'm working on certification to be a coach to teach other health educators how to facilitate visual thinking strategies discussion. So it's a big interest of mine, and it's really the method that that I thought was really useful for medical learners.
Can you tell us a little bit about the method? What about the method do you think medical trainees listening today might be interested in exploring, or how does the method work? I'm sure that it's very complex and complicated, but kind of an overview of it. Yeah.
Yeah, it's not so complex. So it really was, I can tell you a lot of details about the method, but basically it was developed over 30 years ago by Philip Yenawine, who at the time was the director of museum education at the Museum of Modern Art in New York, MoMA. And he was asked by his boss, the director of the museum, if people really learned anything from the educational experiences he offered, which, you know, is a question that we ask too as medical educators, right? Because they got rave reviews, you know, from when school groups or other groups were brought in. Everybody was always very positive, but they hadn't really ever kind of assessed their learners to see if they retained anything. And the main goal of museum education at that time was really kind of information transfer, you know, just like it used to be for medicine in the old days, right? So, the Philip Yenawine, this museum educator, paired up with Abigail Husson, who was a psychologist. She passed away last year. She was a psychologist who studied aesthetic development, and they started surveying their learners or their participants, and found that most people didn't retain anything
Oh, wow.
that they had been taught. And but you know, it had been an enjoyable experience. And so they started studying how people looked at art, and they found that 80% of beginning viewers are really most interested in the story that the art is telling. And so they used that and some other findings as the basis for their method, which is has been, you know, studied, refined, evaluated for, as I said, 30 plus years with all levels of medical learners, from pre-K through adult learners, and more recently in medical learners. And so the method is basically, there's some key elements to it, but basically there's a moment of silent looking at an image or an artwork together. And then there's an opening question, which is, what's going on in this picture? And it's really a series of dialogues. So somebody will raise their hand and say, you know, what they think is going on in the picture. And there are no right or wrong answers, really. The works are selected to have some ambiguity in them, to kind of keep people curious and discussing. So that's the first question, what's going on in this picture? And then if somebody says, well, I think this person is angry or whatever, there's a follow-up question, which is, what do you see that makes you say that? So it really requires the participant to ground their interpretation in evidence, in this case, visual evidence. And you can see the parallels to medicine, right? Because oftentimes we'll say this or that, and when we are really asked to reflect what we see that is making us say that, sometimes we realize that, oh, we're bringing our own biases to the situation. Or, you know, I've had this experience in psychiatry, for instance, where a resident would say, oh, you know, that person is angry. And I'm like, well, the person, you asked them how they felt and they didn't say they were angry. What do you see that, or what, you know, what about that encounter makes you say that this person is angry? And they'll say, oh, well, if that had happened to me, I would be angry. Well, that's, you know, that's different. And so really it's, I think, very helpful to be able to separate our observations from our interpretations. Not that there's not a role for interpretations without observations, but knowing that there isn't much evidence objectively for that interpretation is helpful. So it really helps build critical thinking. And so that's the second question. And then the third question is, what more can we find? So it keeps the group looking and thinking. People revise their ideas. They hear ideas from other people. And so that's what the method is. So I think it has been found in both non-medical and medical learners to build a variety of skills, not only sort of the obvious close observation, listening skills, communication skills, critical thinking skills, but also, you know, it helps people come to some personal insights through their maybe realization of their biases, or realizing that they don't tolerate ambiguity very well, or kind of other personal insights that people can gain. And it also helps people appreciate multiple perspectives so that they can see, oh, I didn't see that, or I didn't think of that, but I can understand how that might be, you know, a possibility. So it helps people, I think, in terms of teamwork, right, to be able to hear other ideas and kind of revise their ideas, stay open to possibilities. And then it also can be used as a sort of a critique of a culture. So you might find, you know, in terms of, like, say, if we're kind of exploring the topic of tolerance for ambiguity, you might realize, I don't tolerate ambiguity well. This person might tolerate it better. And what does medicine say about ambiguity? Does it leave much space for ambiguity? And so you might be able then to kind of use this method to even reflect on the social constructs of a culture. So I found it very helpful as a method.
Yeah, I really like this idea of helping it develop a sense of perspective or different perspectives, because just as you were speaking, my mind immediately went to this idea of how truly in the hospital, you know, there are very different perspectives based on the backgrounds that people came from, especially professionally. So the nursing perspective on a patient is very different than the doctor's perspective versus the physical therapist perspective. And I have found, or I've seen, that sometimes the conflicts that happen in the hospital is this kind of unwillingness or inability sometimes to be able to take on the perspective of, like, why is the nurse potentially upset about this particular situation, whereas from the medical point of view, it doesn't seem as big of a deal. But then once again, that's like a medical point of view that I'm exhibiting, and kind of being able to take that perspective of the other as being really important, because then later on, especially as a trainee, you find that the nurse was totally right, that what they were sensing, you know, was not perhaps on numbers or, something that's objective from a doctor's point of view, but that there was something else that from their experience that they were detecting. And so I really like that aspect of the perspective taking. Um,
Yeah, I would agree with that. And also the facilitator of, say, visual thinking strategies can help frame these kinds of different perspectives too, because the part of the method also is the facilitator paraphrasing, being neutral, using conditional language to help people feel more comfortable speaking their own point of view. So you could say, okay, so you're really thinking about the setting, or you're really
mm,
considering the emotional tone, or you're looking at the color choices, or you're thinking about the symbolic meaning. So there are ways to frame the person's comments that then help us understand where that perspective is coming from too. And also you can do exercises depending on what image you choose, where you're taking the perspective of a figure in the, or more than one figure in the artwork, right? So you can say, okay, you're thinking about the relationship between these two figures, or you're thinking about how this figure might be feeling, or this character about this other character. And so there's ways to take the perspectives not only of the other participants in the session, but also the figures depicted in the artwork, and build
mm,
empathy with those figures as well.
mm. How does, and I know you've been thinking about this idea a lot, but how does art contribute to this deeper sense of professional identity formation, specifically in medicine?
Yeah, so I think that just thinking about our professional identities, um, I think most of the models suggest that there's not a separation between professional and personal identity. Yet a lot of people, I think, coming to medicine feel a tension there. And sometimes they may feel challenged to remain true to their personal identity or their personal values, and they feel that those have to be kind of put aside as they progress in their medical training. And so I think one of the kind of ways that we can have people share some of their personal identities in a way that's not as threatening is through these kinds of conversations, using art as a third thing, it's been called. So it's this, rather than me talking to you just directly about my personal values, sometimes we do exercises where we might show people a deck of either a slide deck, or in the art museum, have people explore galleries, finding a work of art that they can use to, say, introduce themselves to somebody else in either in a pair or in a group. And so somebody might, connect with a painting, and it reminds them of something. They have a personal connection to it, and it reminds them of something that they hold dear, that if they were just asked to introduce themselves to another person, they might not tap into. And it's hard to explain without giving an example. So I'll give an example. So
Mhm,
we had a student in the gallery, and this exercise was find a painting or sculpture that you'd use to introduce yourself to a partner. And so they found this one painting that had a musical instrument in it, and it reminded them of how much they loved playing the trumpet as a kid. And it was the
mhm,
trumpet was one that they had just found. It had been one that their father had played and their grandfather had played. So it had this family connection. And then, so this person took up the trumpet and played it in high school, played it in college, was on the marching band or something. And that's where they met their partner and their best friend. And so it was all this stuff. But if they had been asked to just introduce themselves
mhm,
to their peer, they would never have talked about this connection to music. But seeing that sparked this memory. reminded them of how important this was and allowed them to share a story about that. So it got them a little deeper in a way that wasn't really threatening at all either. They can kind of go to the level of vulnerability that they're comfortable with. And so I've found it really helpful at building a community that where people can actually disclose some personal things without feeling that they're going to be attacked because of it, or that they're going to be, mocked because of it. So it creates this kind of sense of safety and authenticity that I think fosters this kind of ability to then think about how that fits into one's professional identity.
I really like that, especially because I recently had a conversation with another resident in our program who had just mentioned that, she didn't know this other fact about one of our fellow residents and now we've been in residency together for 3 years. And she was saying, it seems like such a basic thing, but I didn't know this about him. And we spend so much time together, but because we're oftentimes just in the hospital working side by side, we don't have the opportunity to be able to sometimes even share these basic aspects about ourselves that can be really crucial to who we are or our identity formation, but that we don't really have the opportunity to do that sometimes. Obviously, I think COVID also prevented some of the kind of getting to know people better in person, things like that. But I do think that as you were talking, I just thought about how great that would be, something like that would be for just building a sense of community within the residency too.
Yeah, I mean, I do think it has value at all educational levels. But what you say, I think it happened before the pandemic too, though, John, because I remember I worked for literally a year with this team on this long-term, this research project, this clinical research project. I mean, we were meeting regularly, we were talking, and it wasn't until like a year later that I realized like 4 of the team members were people of strong faith. And, we never talked about that at all, ever.
Yeah.
But it was just like, oh, really?
Yeah. Yeah, it's amazing. So just to pivot a little bit, I know that as our advisor, as part of the Hippocratic Forum, about our interest in helping trainees develop this deeper sense of ideals in medicine. And could you talk a little bit about how art can help trainees do that?
Yeah, so I mean, I think this kind of connects to what we were talking about in terms of values or virtues. So I do think that you can use art specifically to talk about those topics, depending on the image or piece of art that we're doing so much virtually. I say image now, depending on the artwork that you select, that it may actually have contain themes around virtues, or you can again use it as a prompt for reflection around certain virtues. And that's not just the arts, it's humanities as well. So in terms of developing these, this awareness. So in terms of developing this awareness of one's own virtues, I think these kinds of discussions, again, that are building awareness of developing personal insights, hearing other people's perspectives, all that contributes to discussion about what's really meaningful to you personally, what's valuable to you, what are you striving to be like, what kind of life do you want to construct for yourself. So we've done in our 1-week online course that we've run multiple times during the pandemic, it's a 1 week, each day there's 2 hours or so of in-person sessions, as well as after the virtual sessions, independent work. And lots of those sessions are around these concepts of, family. What is where does family fit into your life? How important is that to you? What communities are you part of? And how does that community fit into your view of a good life? What is work? What is the purpose of being a physician? What's the aim of medicine? And what sacrifices do you have to make? Or do you want to make? How do you preserve yourself and your own identity in these challenging situations? How do you often what's the meaning and purpose of what we're doing? I do a lot of work with fourth year medical students who they know what's ahead. They know what they've gone through so far. Why are they doing what they're doing? Is it worth it? Are they leading less full lives than their patients? And so a lot of the exercises we design are around these themes. Like we have one activity where we ask people to look through a slide deck, or if they're in the gallery, we've done it there too, ask them to find a work of art that speaks to their motivations for entering medicine. Or if they're already further along, what are their aspirations within medicine? So we will design activities, again, using the giving prompts for which people then use the art to reflect.
Yeah, I really like that. And kind of all of those questions are questions that we have been bringing up or will bring up in the different podcasts in the Hippocratic Forum, especially this sense of, why are we doing this, and for what? Especially this idea of what drew us to medicine in the first place, which, in the busy residency schedule, I think that sometimes these thoughts take secondary or tertiary, or perhaps even much lower priority. And I have found that working with different trainees over the past couple months doing the Hippocratic Forum, this reminder of those ideals that brought them to medicine in the first place really helps renew a sense of passion, that initial reason for why I came into medicine in the first place. And that, I think, being a serious or an important way in which we can pursue, especially within this time in residency, which can be challenging. Yet at the same time, what we see in the Hippocratic Forum is that actually perhaps challenging, but maybe the challenges themselves makes it the best time to grow as both a individual in your personal life, but also as a physician. And so, yeah, I really liked all of the things that you said. And, you mentioned one thing about kind of living the good life. And I know that this is something that you also teach, but if you could talk a little bit about how we can use the arts to better understand what it means to be human and to lead this good life, and prefacing that with how do the arts teach us what it means to lead this good life?
Yeah, it's really interesting to meet beginning medical students who have, for the most part, trained primarily in the kind of STEM kinds of courses. And there's this thinking that seems fairly pervasive, at least among the medical students I've been working with at the beginning, that the only truths can come from science. And so the first step, I think, is just helping people see that the humanities offer truths too, and that there are various sources of authority, and scientific authority is one, but then there's the witness authority of somebody who's experienced something. There's experts. There's the the traditional sources of authority, the things that have been passed down, ideas that have been passed down for millennia. So what we do is we read. I have a reading group for students in second year. And we've incorporated many of these readings in the arts-based teaching that we do, where we, read something together. And then it's just simply, what's this story about? What's this poem about? What's this essay about? And then, what truths does it tell us? And there's certain truths the humanities offer that the students see, that it's, that we have as humans, we care about, our fellow human beings, right? But parents mourn their children's deaths. That's a truth, right? That science doesn't really capture. And so coming together around what are these truths, and seeing that these are truths that, aren't going to be accessed through science, that there's something more that the humanities offer, really, and these things that they offer are relevant to medicine, right? We'll read the Raymond Carver short story, A Small Good Thing, for instance, has many truths that are relevant to medicine, that really aren't supplied through science. So that's an example of how we might use the arts and humanities to help people think about, what's true, what's good, what do they want to aim for, in a way that, again, isn't preaching to them about this or that, but people just discover these things themselves and discover the relevance of the arts and humanities to their career as a physician.
As you were talking about that, it made me think about this tension that I sometimes feel in medicine, particularly because of my interests in end-of-life care. And I think in medicine, especially this area of brain death, since I'm in neurology, there's a lot of question as to when does a patient actually die? And, in a certain sense, there's a very medical, I guess, kind of scientific approach to death. But more and more, as I've been kind of experiencing this very uncertain kind of scenarios where the brainstem is still functioning, and so somebody still has a breathing drive, yet their whole cortex is infarcted, and so then where is death? And in many ways seems like more and more of a philosophical question of what death is, rather than purely a kind of science approach of what death is. And so that's just, my personal experience has been something where I've noticed this, tension of the science is not necessarily supposed to answer everything, nor was it designed to. I mean, it's not necessarily designed to answer the questions of the meaning of or the why, but rather the reflection of what the world is around us, and kind of seeing the how it's ordered, and but not necessarily the kind of the driving or the why below all of that.
Yeah, and I think that, again, the arts and humanities can offer a way to approach these topics that allows for the various perspectives to be heard and appreciated, whether it's at the beginning of life or the end of life, right? These are challenging topics to discuss, and to be able to have these discussions in a polarized world, and medicine is just as polarized as the rest of the culture, I think is really valuable, because you may learn something from somebody else's perspective, right? And even if you disagree with their perspective, at least you can respect their point of view, and have an understanding of how somebody might come to that point of view. So I think it's really valuable to have these kinds of discussions. It was, in terms of palliative care, I was thinking I did this fellowship that the Harvard Macy Institute started maybe 3 years ago. So I was in the first group of fellows. It's an art museum-based health professions education fellowship. And there were 12 of us from around the world. 3 were palliative care docs, 3 were psychiatrists. We were overrepresented as a group.
Yeah. Well, we're nearing the end of our time, so I just wanted to ask a final question, which is, do you just have any final thoughts on how the listeners here can gain a deeper appreciation for art and medicine?
Yeah, I'm glad you asked that, John, because this is a really great time to be interested in this field. In 2017, the AAMC, the Association of American Medical Colleges, started an initiative called the Fundamental Role of Arts and Humanities in Medical Education. It goes by the acronym FRAME, FRAHME. And they issued they issued a call for a scoping review. So they commissioned a scoping review, which was completed, I guess, in 2020. And from that scoping review, they issued a monograph. So it's only the 3rd time that the AAMC has ever issued a monograph on a topic, and it's on this topic of the role of the arts and humanities in medical education. So it's a very hot topic. It's got this great scoping review that was the basis of that AAMC monograph, but is also a scoping review that was published in Academic Medicine. The senior author, or the first author, is Moniz, Moniz. And then from that scoping review, that same team actually published a model in 2 journals, one in Academic Medicine and one in the Perspectives on Medical Education. Again, Moniz is the first author on both papers. A model of how the arts and humanities, what functions the arts and humanities serve. I highly recommend these papers. And the AAMC is also going to be offering a course, like its medical education research course that it offers. Is going to be offering a separate course in arts and humanities medical education research. So it's a great time. There's a great interest at the national organizational level in this field, which I see as a wonderful sign. They're really trying to accelerate the research to make more of a case for why these programs and curricula should be in every medical school. And I think that's a move in the right direction in terms of helping kind of advance the more human caring side of medicine.
Yeah, that's amazing. I'm very excited because just 2 days ago I went to the Boston MFA, actually, because there's a very nice thing, and I'm not sure, maybe residents don't know this, but through our residency program, you actually get free tickets whenever to the MFA. And so I've been doing this thing where I've been going very frequently, because otherwise you pay like $20-something. And so then there's kind of this like sense of, if I go once and it pays $20-something, I have to stay like a huge amount of time. But I really love this like fact that I could go really at any time, then and I spend a deeper time in like a section and just really enjoy it, and then not feel badly about coming back another time to really explore another section. And I really enjoyed doing that.
Oh, that's great. That's what's behind me.
Yeah, I know. I was gonna say, I recognize the pieces behind you, especially the ballerina, because the dress there, especially in real life, it looks so real, and it's like, it looks like almost it's flowing, and so I love that sculpture piece.
Yeah, I spent many hours, because of being in the Art Museum Fellowship, as well as taking the Visual Thinking Strategies courses. A lot of time was spent in the MFA. So it's a beautiful treasure. You're lucky to have it. And it has evening hours, which is so great. You can go on dates there. It's wonderful.
Yeah, it is. Well, Meg, thank you so much for joining us today. And in addition to our podcasts and forum posts, we'll also be hosting these conversations with experts to reflect on medicine and what it means to be a doctor, so that we could help trainees gain a deeper sense of purpose and meaning in medicine. So if you have any comments, thoughts, recommendations, feedback, as always, reach out to us at contact@hippocraticforum.org. And please also follow us on Facebook, the Hippocratic Forum, Instagram @Hippocratic Forum, and Twitter @Hippocratic4. Great. Thank you so much for being with us today, Meg.
Oh, thanks for having me. Loved it.